Pukeology Podcast, where science meets your hilarious puke stories and the tips and tricks to stop that chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. Pukeokogy.
Do I need to see a pregnancy specialist? Am I considered high risk? Well, we're about to find out in today's version of Pregnancy Pukeology Podcast, High Risk Pregnancy Edition. I'm sure every mom wants to know whether or not they need an extra doc or a few sets of eyes to look out for them. Want no more morning sickness, pregnancy nausea, or how about no more headaches or migraines? Visit our sponsor, nomonausea.com, the only natural way to instantly stop your worst nausea, vomiting, or headaches now. Or just place No More Nausea Ban on your baby registry for your delivery bag at Bye Bye Baby, or get it shipped for you for free in just 2 days on Amazon as a Prime vendor, because let's face it, we are considered an essential company. And make sure that you know that your little ones are always taken care of with the first and only No More Nausea Kids and No More Sleepless Nights Kids, so that your little ones can get a good night's sleep even during all of this corona craziness. We'll also have some hilarious puke stories that may just make you want to pee your pants, with funny stories like tasty crayons, detergent for breakfast, and microwave asparagus. If you want to learn more about your pregnancy, humor and knowledge is the key to help you survive these 9 months. And just know we're in this together. Today, you will learn the science behind what classifies a high-risk pregnancy and 13 of the most common groups of moms who need to see a perinatologist. And again, we'll never end any podcast without some hilarious and amazing helpful hints to help aid you along this pregnancy in a natural and wellness sense. But let's face it, these are tips for blood pressure, for anemia, and so much more that anyone else could use.
The science of puke, Pukeology.
You're probably asking yourself, am I at high risk for any problems during my pregnancy? I feel like any new mom and or second or third time mom might actually ask the exact same thing. Well, I have to tell you, from personal experience, I had a beautiful baby my very first go around and literally nothing seemed like it went wrong. But I do have to tell you that because of the fact he was holding the cord, my child came out and was little. It's what we used to call IUGR, intrauterine growth retardation. Now, because of the fact that my son was holding the cord like Tarzan and wasn't getting enough nutrients, hence why he wasn't growing, they actually gave me to a perinatologist for my second pregnancy. So I went from being literally never checked. I did go in to see my OBGYN quite frequently with the second one. But again, I was a healthy pregnancy on the first, and boom, he came out small. So they did require me. So I'm kind of telling you from both sides of the coin, not just as a physician, but also as a patient as well. And what does a perinatologist even do? And how are you classified as a high-risk pregnancy? So let's start off with having a high-risk pregnancy means that you and your baby, or both, are more likely to experience some type of health problems during the pregnancy, during delivery, or even after the birth that a normal carrying pregnancy wouldn't necessarily have. To have a healthy pregnancy and to give birth without complications, you need to make sure that you identify it early, that you have regular and extra monitoring by a qualified healthcare professional, and you can't exactly tell when your baby will become high risk. Like I told you my story, everything was perfect up until the time where he had to be taken out and delivered at 37 weeks because of his failure to grow. All of these things may actually increase the risk for pregnancy and complications even before that you conceive. There are other underlying issues, such as medical conditions, that can adversely affect your pregnancy, and you've known about it from the very start. Alternatively, your pregnancy may become at high risk as it progresses. There is no on and off switch. It's not like a light switch. So you actually might have a completely normal pregnancy and boom, all of a sudden something happens that makes you high risk, such as preeclampsia, high blood pressure, things of that nature that we'll end up starting to talk about. But you definitely need to be aware of it because For some, if you are already diabetic, well, you have a high risk of continuing, right? Being gestational diabetes, or you may never had problems with diabetes and all of a sudden you get this diagnosis of being gestational diabetes, meaning that you have diabetes during pregnancy, which increases your risk of having diabetes even after you deliver the baby. I believe it's about 50% chance now. So either way, I don't want you guys to give up hope or think about, oh man, because I have a high-risk pregnancy, that doesn't mean that you're not going to have a healthy baby. I actually have my beautiful daughter who is extremely healthy, even though I was considered high risk after my first one. Eventually, we all do this so that our children will be beautifully healthy, wonderful whenever they deliver. And I can happily say that because of all the extra monitoring, she was absolutely perfect. And that's what I wish for you as well. So what causes a high-risk pregnancy? Having one of the following factors may make you or may consider you as a high risk. So having had problems from your previous pregnancies, such as preterm delivery. Now, I know that we've already talked about what is considered full term. And if you're curious, we do have another podcast that talks about full term delivery and how many weeks is that. But if you're more specifically curious as to what is considered full term, is really anything after 36 weeks. Now, they will not schedule an elective C-section before 39 weeks because they've learned that the baby's brain grows more and more as you progress in your last and third and final trimester. So we want to cook those babies in there as fast and as long as possible. So keep them in that nice little jacuzzi as long as they can be to be protected. But if you did have problems with your first one, like I talked about before, and preterm for me, because at 36 weeks, they wanted to take him. And so I really had to make sure that I was on bed rest for 1 whole week until I was 37 weeks. So because of this IUGR and this intrauterine growth retardation, meaning that my son just wasn't progressing, because of those 2 items, I was considered high risk the very next time I got pregnant. And if I were to get pregnant over and over again, I would have to continue to see a perinatologist. Although you might not actually experience the same problems in your current pregnancy, this is important to be looked at and to be monitored closely by a healthcare professional to prevent it or prevent the same thing from occurring a second time. Number 1, if you have multiple gestations, if you are a multiple delivery, you've never had twins before, you actually are considered high risk and you're going to be looked at more so by your OBGYN. That doesn't mean that you're not carrying 2 perfect little babies or 3 or 4. Oh my goodness, I can't even imagine. But I do have to say that having multiples will already put you at the top of the echelon for taking a look at you very, very closely by your OB. Now, sickle cell anemia and thalassemia are 2 blood disorders that can make your pregnancy high risk from the get-go. So if you have not just sickle cell anemia, but also sickle cell trait, the health of your baby is also threatened during and after the delivery if you acquire or have this condition. So sickle cell anemia, anything that says anemia, has to do with red blood cells, right? Well, a normal red blood cell, think of it as a nice looking donut, okay? But imagine that there's no hole in the middle. And what that is that red blood cell can actually hold on to oxygen as best as it can through utilizing hemoglobin. Heme is that iron-based, and it grabs and holds on to oxygen and then delivers it all through the body. The problem with sickle cell is where it looks like a crescent moon. And that crescent just can't hang on to the oxygen as well as it needs to. So what ends up happening is it's a problem with the actual production of the red blood cell. But because of the fact that our neighboring sisters over in Africa, there was a really high risk of having malaria at some points in time, and there still is because of all the mosquitoes. And sickle cell actually is an anti-malaria response that your body or that the women in Africa's body ended up creating so that they wouldn't be affected by malaria. The problem is their regular red blood cells don't function the way ours do. So it's usually associated with severe pain, anemia, meaning that, your face looks very red looks very pale and flushed, not red and pink like everyone else. And there's a lot of fatigue. You're not getting the oxygen that you need. You're not getting the vitamins, the nutrients. And it's very, very important to keep up your health of your B vitamins, hence a good diet, making sure you have a lot of iron. And we're going to talk about that a little bit later. Obesity is actually the third. If you have a body mass index, a BMI, of 30 or higher before you're pregnant, your chances of having high blood pressure, which is type 2 diabetes, and gestational diabetes when you get pregnant are pretty darn high. During the birth, you may mostly need to have a cesarean section just because they want to decrease the complications and or the length of delivery time. We never want to stop the baby from oxygenating their brain. And to avoid the risk of that, cesarean sections are the fastest, quickest way, because when you cut a woman's abdomen, you can see the baby immediately and then end up delivering just fine. But that doesn't mean that just because that you are obese before you get pregnant that you will need to have a cesarean. It's just these are the common reasons and or complications that would cause a physician to say, maybe this person is at risk, and to avoid all the rest of the risk from here on out. There's also a certain amount of what's considered what is my perfect type of pregnancy weight. So I really want to make sure that you are taking a look at the other podcasts. There is one. How much weight should I gain during pregnancy? Pukeology episode 16. Go take a look at it. And it actually gives you hints, if you are overweight at the beginning, how much you should be progressing. And then if you are normal weight. Chronic kidney disease is considered the fourth one, when your kidneys just are not functioning properly, either from internal damage to the actual kidney and or blood pressure issues from the outside. If you have a family history of high blood pressure, familial hypertension is what it's called, your vessels are really, really tight and little. Now imagine a really small vessel to your kidneys, and then you make it even smaller. Or you have natural high cholesterol, meaning that you're not able to really get blood going through that vessel, and this can cause a decreased amount of blood flow to the kidneys, and we need our kidneys. Our kidneys are what flush everything. So again, please make sure that if you already have chronic kidney disease, or if you know that you have problems with your kidney, or if you were only born with one kidney, the probability of having preeclampsia, of developing high blood pressure is high. And also, again, what we don't like to talk about, but the probability of miscarrying is higher than those who have a normal and don't have any issues or complications with their kidneys. Depression is number 5. Mental health and wellness is really something in this country, in the U.S., that we need to be looking at even more. And everybody gives a lot of attention post-pregnancy to postpartum depression. But I really want to bring it about as a complication of having during the pregnancy stage. So a pregnancy may make you suffer from mental disorders like depression or anxiety. This can all also go down, if you've ever heard of the term pica. It's where women will end up seeking, they're losing and needing nutrients. So they actually start consuming very bizarre things like soil, like dish detergent, things of that nature. And this can also lead to mental instability because they're putting in their bodies these toxins that are not normally craved by the body. Different medications for depression and anxiety. You'll hear about it a lot on the television and or on the computer. A lot of these have to do with serotonin reuptake inhibitors, norepinephrine reuptake inhibitors called SSRIs or SNRIs. And all of these medications can be harmful to the baby. They actually don't recommend them in pregnancy. Now, the problem is if you have a mom who is suffering from depression before, it increases the risk of having postpartum depression, but even depression during pregnancy. Because let's face it, I know that I would love caffeine, and me not being able to consume caffeine on an everyday basis, I had a bad headache. So I can only imagine having a mental illness and not being able to be appropriately medicated. So please make sure that you talk to your healthcare provider and talk to them and really explain, just because I'm pregnant and I'm having a lot of things changing, then we need to make sure that we keep up my mental health and mental stability. All right, the 6th thing is high blood pressure. You can have a normal pregnancy with high blood pressure, but if not treated, the high blood pressure may cause a growth deficiency in your baby, as well as may cause the baby to be born before its normal gestation period. I talked about my child had IUGR, intrauterine growth retardation. It wasn't because of the fact that I had preeclampsia, because I had no high blood pressure issues. But again, high blood pressure can also cause preeclampsia, abruption to the placenta. Just think of any type of traffic, right? Traffic jam. It's high blood pressure is squeezing those vessels and is trying to push through, push. Now the vessels are really tiny, right? So again, other complications can happen. The uterus itself, and in what the baby is actually being housed in, the nutrients that they're getting from the placenta, they're not getting the same amount of nutrients if you have high blood pressure. Remember that the baby is like an organ. It takes about 15% of your blood flow. And if that area is decreased, the baby's not getting as much. And so you have to make sure that you are seeing your healthcare provider, that you're checking your blood pressure, making sure that nothing goes out of whack. And again, the huge signs of preeclampsia that could potentially turn into eclampsia, which means it goes from just being high blood pressure to horrible headaches, flank pain because your spleen is literally like abrupting because it's got so much pressure, to having seizures. And that's what eclampsia is. Eclampsia is full-blown seizures caused by a high blood pressure scenario. And the only treatment for preeclampsia is to deliver the baby. I think I'm on 7 or 8. HIV or AIDS. If you are a victim of HIV or AIDS, your baby may be infected before birth, during birth, or during the breastfeeding period of time. However, the risk may be prevented through different types of medications. And for you to note that you and your baby don't share the same blood, because of the fact that a mother's blood can be different than the child's blood. It's important that you note that that's the reason why they usually try to make sure that they avoid any potential contact between the baby's blood and the mother's blood if you do have these two deficiencies such as HIV or AIDS. So they will schedule a C-section more than likely. Autoimmune conditions like lupus, for example, this actually increases the threat of having preeclampsia and preterm delivery and giving birth to a small baby, that IUGR that I keep talking about. And lupus may actually worsen due to pregnancy. And so lupus is most known for this butterfly-looking effect. It's almost looks like a red, purplish rosacea that kind of comes around the face. But, rosacea is also, lupus is painful. So again, those who suffer tremendously from pain all over the body, as well as any other autoimmune type of deficiency, you're putting a lot of stress and strain on the mother's body by carrying this extra child. So just note that you are considered high risk, and it's okay. Talk to your doctor. They've seen it before. Advanced maternal age. I hate saying that I am part of this group. Age determines the kind of pregnancy that you'll likely have. So the advanced maternal age sticker happens at 35 and older. So for first-time pregnancies, anywhere in your teens all the way up until you're 34, you really have a very decreased risk of having complications. But when you get over 35, remember that the production of your eggs and the quality of your eggs is decreasing because you're born with the same amount that you have, and that will be released over an extended period of time in your life. So these health complications, we know that trisomy, or having a Down's child, increases the risk significantly if you are of advanced maternal age, and you will want your OBGYN to take a look at you very closely with this. Number 9, thyroid disease. If you have current thyroid disease that is uncontrolled, especially when you're pregnant, it can affect you and your baby in a huge way, such as rapid changes in weight growth or weight loss, for example. These thyroid diseases can also cause your baby to be born with a low birth weight or preeclampsia, a potential miscarriage, or an early birth. I mean, all of these things. Thyroid is what is the hormone that's going to be secreting things for not just calcium from your parathyroid, but also your thyroid itself is going to control how heightened and energetic or how lethargic that you are, because it's a hormonal imbalance. And those who have goiters, which are a thyroid that kind of gets really big and inflamed, you can actually see them on the base of the neck. And so it is very scary if you were not diagnosed with hypo or hyperthyroidism and then boom, you're pregnant. Now we need to watch you even much more closely. 10 or 11, alcohol. Again, it's still a huge risk for a stillbirth. It's not worth it, ladies. Having fetal alcohol spectrum disorder, FASD, happens if you are drinking heavily while pregnant. It causes these babies to be born very small. Sometimes they have their heads are too swollen, and they cause, developmental delays, and it's actually very terrible. So alcohol is absolutely 100% a drug. Smoking during your pregnancy puts you and your baby at very high risk and several complications. Being born early, so preterm labor is probably the most common, but also it is having a smaller child. It's having a child that is so highly accustomed to nicotine that they are now starting to figure out that these babies are being diagnosed more with different types of attention deficit disorders, things of that nature, because of the nicotine content, the constant craving or the constant needing. I know that it's hard. Like I said before, I love caffeine, and just think about it. It's only 9 months, ladies. And if you can do it for your baby, because for the rest of their life, you're going to be the one that's taking care of them, and you're taking care of them right now. So cut any type of habits. And that leads us to our last one. Any type of substance abuse will make you automatically at high risk. Your baby may suffer from different birth defects, not just low birth weight and being born early, but if you're misusing prescribed legal drugs, not just abusive illegal ones, legal drugs, the different types of pain medications, things of that nature. So please not only see your pain doc, but also please let your OB know that you are seeing a pain specialist, and come up with different things, other wellness aspects and attributes. And we're going to get into that. And the last that I want to throw out there is I have taken care of many substance abuse children. And whenever they are delivered, if you've ever gone to see them in the NICU, which is the neonatal intensive care unit, they're literally on a little swing at like 100 miles an hour because they're so used to that constant. Think of what cocaine does to a regular adult. Now think of what that does to a baby. And the concentration is so much greater. So these, what they call crack babies when they're born, they are literally on this swing at 100 miles an hour, I feel like, where they're back, forth, and they can never constantly get that relaxation and rest like any of the other babies. So if any of my stories can help to bring yourself at ease and bring yourself at peace when you know that you're taking care of not just yourself, but also another living life, please consider your options, your choices, and go natural whenever that you can.
Throwing up on a Tuesday? One puke story.
Since that last bit was like so crazy intense, I felt like I needed to break it up with some hilarious puke stories from our listeners. The first one, tasty crayons. So my toddler was coloring this really pretty picture, and I was doing the dishes, never thinking that there was anything going wrong. All of a sudden, I look over and I notice that there's some different colors on my son's chin. I go over to wipe it off, and I thought maybe it was just some of his fruit that he had left over from breakfast, but no. The second that I found out that he was eating crayons, he ended up puking up the rainbow. Now, for most moms that were first-time moms, that wouldn't be an issue, but I have an extremely sensitive stomach and started vomiting all over myself as I was trying to clean off my son's puke. It was so gross. All I know is that I didn't even want to have to do the laundry because it would remind me of the smell again. Thank you, Cece, for that hilarious puke story. Make sure to send some more. Detergent for breakfast. I have to also put my 2 cents in here real quick. When I read this in the comment section, whenever they were sending me the story, I was like, detergent for breakfast? I mean, it literally caught my eye. So my husband was sitting, and I woke up much earlier one day when my husband was making coffee in the kitchen and was wondering where I was. Now, I did not know that I was having a deficiency during my pregnancy, and my husband hears me in the laundry room. No big deal, thinking maybe I'm doing laundry. I was eating laundry detergent by the handfuls. I was diagnosed with pica thereafter and would crave weird stuff like laundry detergent, bleach, soil. Well, anyway, my husband started vomiting because he couldn't even believe his eyes of like what I was doing. And he starts shoving his fingers down my throat and asking me to throw up because he didn't want our child to get affected. So imagine we're in the laundry room and he's shoving his fingers and all I want to do is eat this detergent. Anyway, he vomited, I vomited. It was like Vomit Fest 3000. Wow, Karen, that was pretty. Karen as in 772. That was really intense. Again, I don't think I'll look at laundry detergent the same way. Well, my husband's favorite thing was asparagus. So I never knew how to make asparagus, but I saw it on sale at the store and thought this would be a good thing. It was my very first pregnancy, and I wanted to make him a nice home-cooked meal. So I decided to cook the asparagus inside the microwave because you can cook anything in the microwave, right? Well, I've hated asparagus my whole life, and all of a sudden, from the time that I got the asparagus out of the microwave to the time that I walked to the table, I had eaten half of the asparagus. He looks up at me and says, "Honey, you don't like asparagus." I looked at the asparagus and was like, "Oh, I don't know why I ate it. This baby wanted asparagus, but I think it tastes gross." And just started puking all over the home-cooked dinner that I had in my hand. My husband's so awesome. He took us out for Chinese food takeout. Thanks, Tiff 75 Mom 3. Yes, for that hilarious puke story. And if you have a hilarious puke story, send it to me, Pukeology at nomonaja.com, or tweet me at Pukeology, Pukeology, so we can all have a good laugh.
Tips and tricks to stop the chuckle that you need.
Reduce the risk of pregnancy complications when you have a high-risk pregnancy. So what are these different tips? And again, I'm going to go through them in a very generic sense, but then get down to the real nitty-gritty. So seek support from your family, your partner, and friends, particularly when you have some sort of anxiety or depression. No Mo Sleepless Nights is out there if it's something that you can't sleep, utilizing lavender and essential oil, also in combination with acupressure at a sleep point. So think of different points that you could potentially use for acupressure that you can do at home, or seek an acupuncturist because that's actually considered very safe during pregnancy. And it's something that's natural to help increase your natural hormones, your natural beta endorphins, to give you that boost. Start exercising regularly. Exercise increases endorphins. Endorphins are happy hormones. And when you're having happy hormones, you can have your brain talk to each other a little bit better. So maybe you start your day off every morning with just a walk. But don't forget, during COVID-19, make sure that you walk in a non-populated place. And if you do walk in a very populated place, make sure that you do and you are wearing a mask, because pregnant women are more susceptible to things in their respiratory tract. Seek relevant information concerning your condition and what you can do to stay healthy. There's a bunch of natural wellness, from the blog found on Nomonaja to other different naturalists or other naturopathic physicians who talk about wellness tips, who talk about different encyclopedias for essential oils and what those can actually do for you and your baby. So instead of always thinking, inside the box, look outside of the pill box, especially when you're pregnant. Attend all of your prenatal appointments and make sure that you schedule them at a time to where you'll be able to make it. I say that because, again, coming as a physician, the last thing on the planet we want are late patients, but vice versa. If we get backed up because we have an emergency or something of that nature, we want to make sure that you pick a time that's good for you. I always say, when you first open, or be the first one after lunch, because lunch is something that is it has an ebb and flow, and get accustomed to making your appointments the same day. By that I mean pick it, whether it's a Monday, a Tuesday, a Wednesday. I will say if you do the middle of the week is probably better, Tuesday, Wednesday, or Thursday, because Mondays and Fridays are usually jam-packed since nobody's working on the weekends. When you attend your first prenatal visit, inform your provider about any current issues pertaining to your health. So do you have a family history of hypertension or high blood pressure? Do you suffer from anxiety, depression? Do you have multiple drinks per day and you consider that normal prior to getting pregnant? They can also help to inform you on different ways to stay healthy and to kind of get your mind off of it. So if you're a person who's constantly using a cigarette or something that is, to the what we call oral cephalic sensation, you can start using metal straws whenever you drink things. So to constantly have that something inside of your mouth, or you may want to start considering chewing gum. You'll still have that same mouth type movement, and it might get your brain off of the other things that you don't necessarily need in your body for you and the baby. In the case that you are not pregnant yet, thank you, by the way, because let's be real, information is the best thing and the best way. But if you're not, schedule a preconception visit. Yeah, you heard me. A preconception visit with your healthcare provider. She can probably go over all of when is the best time to get pregnant. And if you're ever curious when to make a boy versus a girl and how, it's not 100% chance, obviously, but there are different Chinese calendars that are out there that have gender basis based on the mother's age and based on when you want to try to get pregnant, as well as some sexual positions that actually might help to make a boy versus a girl, and or vice versa. Eat healthy. For those mommies who have sickle cell anemia and trait, try eating foods that are high in iron, like salmon, sardines, liver, organ meats, or lentils. Now, I know that sardines, liver, and organ meats sound super gross, but I had honestly the most delicious bone marrow soup that I've ever had. It was absolutely amazing, and they added things like basil, they added rosemary. It was so delicious, and you can actually find it on a lot of Thai menus. So go try those other type of amazing organ meats, because they're really going to be filled with great red blood cells that you need. Or eat foods that are high in folate. We always say that women need folic acid, which will help to increase the production of red blood cells, like chickpeas. Hummus is a great way to get your chickpeas in. Pinto beans, lentils, spinach, avocados, beets, broccoli, asparagus. For a full list of items that you should be eating during your pregnancy, head on over to Pregnancy Pukeology Podcast, episode 16. Try essential oils, ladies. If you're a mom who gets aches and pains from sickle cell, try rubbing peppermint oil and even turmeric. Turmeric helps to decrease inflammation and stop pain all over. If you are a mom that has high blood pressure, try dandelion root tea, which is a natural antidiuretic. It will help to kind of get all of that water weight off. And water weight is actually, that's what, when you have high blood pressure, if you've ever heard of HTZ, it is a water pill that they give you. So it's the same concept. Now, if you're a person who has really bad pain all the time and you've been suffering and actually seeing a pain specialist and taking Oxycontins and Roxys, try Capsin. Capsin is like a pepper. It is, they make these patches now that you can actually put on. They also have these lidocaine infused patches. They have TENS units. TENS units is awesome because it delivers high frequency jolts. It's kind of like when you put these pads on, it makes you pretend like you're doing crunches. I don't know why I was actually doing crunches when I was doing this podcast, but it gave you the same entity to where you're really contracting. And they use this for people who suffer from severe back pain and from sciatica. And there's some great yoga out there. Go take a look. There is an entire section dedicated to sciatica during back pain. And if that's you because you've had a car accident in the past or an injury as an athlete, try the things that are natural that can help both you and your baby flourish. Remember that lavender is great from relaxation if you suffer from any type of depression or substance abuse. And nomonaga is a natural way to help reduce the side effects of not just morning sickness, but also for addiction, especially in alcohol withdrawal. Remember that a lot of doctors, they are going to want you to try to take something that's going to take your mind off of the severe nausea and vomiting from not having an alcoholic beverage. Or try no more migraine. If you're a person who's addicted to caffeine, where you're so used to drinking 5 Coca-Colas a day or 5 cups of coffee a day, that headache, you can subside the actual side effect of a headache by utilizing acupressure and essential oil. Go check it out, nomomigraine.com. Now remember, all of us doctors are here for you. We want you to be honest with us so that we can help you and your unborn child. I took a Hippocratic oath to do no harm, and that's what I plan on doing for you and your baby. And by me challenging you from not just your, weight, but also to your substance abuses or habits that you may have that are just not good in pregnancy, and even more. A lot of us don't eat right, and this is the time that we need to. During 8 to 12 weeks of the baby's age, this is what we call organogenesis. They're creating their organs. And most importantly, and last but not least, take note of your emotional well-being. Mental health is extremely important, and even more so. If you are sad, the baby's sad. If you are happy, the baby's happy. So anything that you can do to lift your spirits, do what makes you happy. If that's a bubble bath once a week, or if that's jumping on, going swimming for an exercise, anything that makes you feel at peace, at ease, and to note that you are still an incredible woman and you're making a baby. That's your superpower. I want to thank you ladies for joining me for Pregnancy Pukeology Podcast, episode 37, High Risk Pregnancy Edition, and hope that you now have a better understanding of the 13 most common groups of moms that are considered high risk, when you need to schedule an appointment with a perinatologist, and what are those things that you might want to talk about with your OBGYN even before you take this beautiful journey in pregnancy. If you love this podcast, let me know with 5 stars or hearts for likes. And don't forget to download this episode, but more importantly, share it with all your prego friends. Thanks for listening to Pregnancy Pukeology Podcast, High Risk Pregnancy, episode 37. See you guys in 2 weeks.
Pukeology Podcast, edutainment at its finest.